Hi, I'm Dr. Art Mollen. Welcome to Feeling Good. You know, everyone's always looking for the magic pill or the silver bullet, which is going to be a lot easier to swallow than exercise for their health. But let's say I paid you $100 a week to exercise. Would you do it? Well, of course you would. Well, so let's look at it this way. That $100 a week is like putting exercise into your bank account. It's your bank account for your health when you get older, because that's exactly what it's going to cost you when you're 75 years old to take care of yourself. In fact, Thomas Jefferson once said you should devote at least 2 hours a day to bodily exercise, and if you didn't want to do it, that's okay, because later on in life you'd wind up devoting at least 2 hours to taking care of your disease. And speaking of preventing disease, let's talk about artificial sweeteners. We've heard so much about aspartame in recent years. Well, it's been deemed to be safe by the European Food and Safety Authorities. They claim the artificial sweetener aspartame is safe at the levels that are currently being used in soft drinks. Aspartame is often sold under brand names such as NutraSweet and Equal. And they've been in soft drinks, in fact, for probably the last 25 years. Now, the National Cancer Institute has also evaluated these, and they said there's no evidence linking aspartame and cancer, or that the sweetener harms the brain, the nervous system, or affects behavior or mental skills in developing children. And that's an interesting point, and that's coming again from the National Cancer Institute. So that's a particularly interesting point. And if you're thinking about getting a tattoo, well, let me give you the real facts about it. It requires breaking the skin and having contact with blood and bodily fluids. So make sure that the business license from the person you're getting it from is up to date. Don't drink any alcohol or take any drugs the night before you're going to get it or while you're getting it. Any type of tattoo involves health risks. The worst is a dangerous infection like HIV or even hepatitis C from unclean needles. You could even get a MRSA infection or impetigo, staph infections such as cellulitis. And some people are often allergic to certain tattoo inks, particularly the red inks. The bottom line, if you're going to get a tattoo, consider it to be permanent. They are not as easily removed as a lot of people may think. Well, now I have a call from Melanie. Melanie, thanks so much for calling. How are you today?
I'm great. Thanks, Dr. Art. I have a question for you.
Yes.
I work from a home office, and I occasionally get a pain on the right-hand side of my neck from my ear down to my shoulder, and I was wondering what you can recommend.
Well, you know, when people have neck pain and they work on computers on a regular basis, it's very, very common for them to have a little bit of a bulging disc. A bulging disc is something that can potentially cause pain into your shoulder. It can radiate into your arm and your hand and even cause some numbness and tingling. Now, having said that, if you've been doing any type of exercise, that can certainly be a contributory cause. If you've had any previous accidents, a lot of times people have accidents and they don't realize it. It was a car accident, they were hit from behind. They could have a little whiplash that actually is a residual effect, and it could occur over a long period of time. I mean, maybe 6 months or even a year later that you could still be having that. In addition to that, if you're on the phone constantly with people and you're holding the phone between your head and your shoulder, and I've seen a lot of people that do that, that could possibly be the issue as well. So I would suggest simply taking some ibuprofen over the counter. That's a simple way to reduce the inflammation on that particular disc and everything. I like that treatment. It usually works pretty well for most people. And then if it doesn't resolve, you ought to have an MRI, magnetic resonance imaging of the cervical spine, just to discern if you have a real bulging disc problem. But most often that should resolve within a several week period.
Thank you.
You're welcome. Thanks so much for calling, Melanie. Talk to you soon. So if you've been having any problems and you want to Skype in next week, be sure to call in And we'd be happy to listen to your calls, or you can email me also at askdrartmollen@gmail.com, and we'll be taking your calls. But now it's time for Real Men and Real Talk. You know, there are a lot of drugs out there for erectile dysfunction, and many of those drugs have been around for quite some time. Those medications include Cialis, Levitra, Staxin, Stendra, and of course the little blue pill. They all work the same. It's called Viagra. They raise levels of nitric oxide in the body. Nitric oxide helps the blood vessels in the body and those important parts of the anatomy to relax. This is the key to keeping an erection. However, if erectile dysfunction is being caused by, say, side effects from medications you might be taking, it could be a high blood pressure medication, it could be a medication you're taking for depression or anxiety. All of these can potentially cause you to have those side effects of erectile dysfunction as well as emotional issues. And so look into that before you jump out there and decide you're going to get that little blue pill that your doctor prescribed for you. And speaking of the little blue pill, well, where's the sex drive drug for women? Women often complain, why isn't there a female Viagra or a treatment that boosts the female sex drive? Well, there might be. It's called filobacerin, and filobacerin has maybe a potential to helping women, but unfortunately the Food and Drug Administration has rejected it. A 2013 study in the Journal of Sexual Medicine showed that women taking the drug filobacerin reported an increase in satisfying sexual events when taking it for a regular period of time. Now, it's not a hormonal treatment, and it doesn't appear to even affect fertility or interact with the birth control pills that women often take. The drug works by increasing certain brain chemicals. Those brain chemicals actually include dopamine, neurotransmitters such as epinephrine. It doesn't seem to affect as much of the serotonin levels. In fact, it may even lower serotonin levels. The side effects include a little bit of dizziness and some sleepiness, and it has been linked to some side effects, but they don't seem to be that serious. The treatment for men, which men take Viagra or they take Cialis, is a little bit different than filobacerin because filobacerin needs to be taken every day. Sex drive is a lot more complicated, however, for women than it is for men. There are a lot of other factors that could be explaining a woman's low sexual desires, and not all of them are medical. So there are a lot of emotional issues that might be on the table there. And have you had a sports injury recently? Well, most sports injuries are actually minor. An ankle sprain, a pulled muscle, a tennis elbow. A lot of them are due to overuse injuries, such as, for instance, say you're a runner, you're training for a marathon, you suddenly increase your distance too quickly. What happens a lot of times, people don't realize that increasing that distance, say from running 3 miles a day to 6 miles a day, that's going to cause an injury simply because it's an overuse injury. Well, rest and ice are actually sufficient for most minor injuries. The most common injuries, again, are going to include, say, a shoulder injury, a knee injury, such as a tendonitis, a low back injury, or even an ankle sprain. There's a simple acronym for most of these sports injuries. It's called RICE: rest, ice, compression, and elevation. That will often treat most of those types of sports injuries you get. And finally, what about alternative treatments? You know, there are a lot of alternative treatments that we often see out there. And what about those treatments for depression? Well, there's no conclusive evidence that any of these complementary or alternative treatments or home remedies are completely effective, but they may help a person who has depression actually cope with it for a short period of time until they get to see their doctor. It could include aromatherapy, it could include biofeedback, or even some of those supplements that you might be taking. A lot of people like massage therapy, meditation, and even yoga. Yoga can often help a lot of people who have some of this type of depression by simply relaxing them. And the supplements that are often used, such as St. John's wort, they can be beneficial for some people, but using an herbal supplement over a long period of time, you have to be very careful and you have to weigh the benefits versus the risk. You should discuss that with your doctor before trying any of these alternative therapies. The one alternative therapy that I like the best is exercise. Exercise increases beta endorphins in the brain. It simply makes you feel better about yourself on a regular basis. So whether it's 30 minutes or 60 minutes of walking, jogging, bicycling, swimming, taking a dance class, all of those can actually help a great deal. So if you'd like to get a hold of me, be sure to email me at askdrartmollen@gmail.com and I'll try to answer some of your questions. Be sure to watch Feeling Good next week. I'm Dr. Art Mollen and I hope you're feeling good.